Every Jamaican knows this feeling deep in their bones. A loved one suddenly falls sick. Panic sets in, and you rush them to the hospital hoping for urgent care. But instead of immediate help, the waiting begins. Minutes stretch into hours. Machines are broken. The shelves where medicines should be are empty. The nurses are exhausted, the doctors overwhelmed. And in that dreadful pause between hope and despair, one haunting question lingers. Will they make it, or will the system fail them? This isn't just one person's tragedy. It's the daily reality of an entire nation, an island admired around the world for its music, resilience, and spirit, but one that trembles whenever illness strikes. Today, we're pulling back the curtain on Jamaica's healthcare system. Its proud history, its crumbling present, the billions that disappear, the scandals that make headlines, and the human cost that rarely gets told. By the end of this, you'll understand why Jamaicans call it not just healthcare, but the price of survival. But before we dive in, hit that subscribe button. On this channel, we tell the stories that others overlook, the ones that touch real families and expose the truths buried beneath headlines. Trust me, what you're about to hear will leave you asking difficult questions about leadership, accountability, and survival itself. On paper, Jamaica can boast of healthcare giants. Kingston Public Hospital, KPH, stands as the largest hospital not just in Jamaica, but in the entire Caribbean. Built in 1776, it carries more than 2 centuries of history. Victoria Jubilee Hospital, meanwhile, is where over 8,000 babies take their very first breath every year, making it the beating heart of maternity care across the island. These are achievements worth celebrating, at least in theory. They paint the picture of a country equipped with medical landmarks and proud traditions. But step through the hospital doors, and that pride fades quickly. Kingston Public's wards are bursting at the seams. Patients packed into crowded spaces where privacy and comfort are distant luxuries. Mothers of Victoria Jubilee wait long, anxious hours before a nurse can even attend to them. And for rural families in places like St. Mary, Clarendon, or Portland, the story is even more painful. Ambulances are scarce. Roads are poor. Many travel miles, praying their child will survive long enough to reach a doctor. Behind every glowing statistic lies a painful contradiction. History cannot heal wounds. Pride cannot replace functioning ventilators. Numbers mean nothing when families sit on benches, watching time slip away while loved ones fade. Each year, Jamaicans are told a familiar story. Billions of dollars allocated to healthcare. Budgets celebrated. Headlines glowing with announcements. Ministers standing at podiums, promising modern hospitals and cutting-edge machines. In 2023, for example, over 14 billion Jamaican dollars were directed toward healthcare. Kingston Public was promised a sparkling new diagnostic wing and state-of-the-art operating theaters. Spanish Town Hospital was lined up for CT scanners, dialysis units, and ventilators, equipment that separates life from death. But here's the hard truth. Where does the money actually go? Time after time, the same pattern repeats. Projects stall midway. Machines are delivered, but never used because no staff were trained. Renovations announced with fanfare are delayed for years. Take Cornwall Regional Hospital in Montego Bay. This hospital is supposed to serve hundreds of thousands in western Jamaica. Renovations began years ago, and the cost has ballooned by billions of dollars. Yet the work remains unfinished. Patients are crammed into temporary wards that barely meet basic standards. And it's not just inefficiency, it's whispers of corruption. Contracts awarded to political allies. Equipment purchased without maintenance plans. Machines left to rot. Ribbon-cutting ceremonies staged for half-completed projects. Meanwhile, patients wait in pain, some never making it back home. Every mismanaged dollar isn't just wasted money, it's a life at risk. Budgets can be debated. Statistics can be twisted. But the human cost cannot be denied. Jamaica has some of the most talented doctors and nurses in the Caribbean. Their dedication is unmatched, but the conditions they work under are unbearable. Nurses recall nights where 2 of them care for 60 patients. Imagine that, 60 human lives crying out for help, attended by only 2 exhausted nurses. Doctors describe operating without the proper tools, improvising in surgeries where precision determines survival. Emergency wards run out of ventilators. Surgeries are postponed not because the doctor is absent, but because the machine required is broken. And then comes the exodus. Fed up with long hours, dangerous working conditions, and salaries that can't sustain them, Jamaica's best-trained healthcare workers leave. They migrate to the UK, Canada, the US, countries that welcome their skills with open arms. But every departure is a wound. For every nurse that leaves, hundreds of patients back home are left behind. For every doctor that migrates, years of government investment vanish, only to benefit foreign health systems. This isn't just a staffing crisis. It's a national emergency. The more workers leave, the worse the conditions get. The worse the conditions, the more patients lose trust. The wealthy escape to private hospitals or fly overseas. And the public system, built for the majority, crumbles. Jamaican politics is rich with promises. Every election brings visions of modern hospitals, digital systems, and healthcare for all. But what remains once the cameras leave? Cornwall Regional became the poster child of failure. Billions poured in, contractors paid, deadlines missed, reports leaked of shady deals. And still, patients wait. Other scandals exposed overpriced medical supplies, malfunctioning equipment purchased without service agreements, and medicines expiring in storage while patients went untreated. This isn't just incompetence. It's corruption, and corruption kills. Every inflated contract means fewer funds for dialysis patients. Every stalled renovation means another mother giving birth in unsafe conditions. Every photo op with half-finished buildings means another child waiting for medicine that never comes. Investigations are launched, committees formed, but most end quietly, reports tucked away in cabinets while families bury loved ones. The cycle continues. Healthcare in Jamaica is no longer one system. It's 2 worlds. For the wealthy, private hospitals feel like another universe. Clean rooms, functioning machines, quick access to specialists. It feels like hope. But the cost? Devastating. An MRI scan costs between $40,000 and $60,000 Jamaican dollars. A surgery can reach into the hundreds of thousands. For the average Jamaican household, those numbers aren't just high, they're impossible. Families sell land, take out loans, or beg relatives abroad just to cover treatment. And for those without such options, the reality is cruel. They wait in overcrowded public wards, or they watch helplessly as loved ones slip away. Even the wealthy know limits. Many fly to Miami, New York, or Toronto for treatment, widening the gap between those who can afford survival and those who cannot. The crisis is not just about patients. It's also about the very professionals holding the system together. Jamaica invests heavily in training doctors and nurses, but the reward of that investment often flows elsewhere. Within 3 years of graduating, more than 70% of Jamaican nurses migrate. Many doctors follow. The reasons are obvious: higher pay abroad, safer working conditions, opportunities for growth. At home, they face overcrowded wards, broken machines, and salaries that can't support their families. It's a wound that never closes. The more the nation invests in training, the more it loses to migration. The more it loses, the weaker the system becomes. It's a cycle draining the country of its brightest and best. Here lies the real question. Can Jamaica's healthcare system be saved? The answer is yes, but only with radical change. Machines won't fix the problem alone. New buildings won't matter if corruption empties them of supplies. Reform must dig deeper. Transparency is the starting point. Every dollar spent should be tracked and made public. Training must be tied to every equipment purchase. Incentives, better pay, safer conditions must be offered to keep nurses and doctors home. Partnerships with NGOs and tech innovators can bridge gaps, using telemedicine and mobile clinics to reach remote areas. There are sparks of hope. Community clinics run by churches and local groups. International organizations donating not just machines but training. pilot projects in telemedicine connecting rural Jamaicans with specialists in Kingston. These examples prove recovery is possible, but hope alone is not enough. Change requires Jamaicans demanding accountability, leaders treating healthcare not as a slogan, but as a sacred duty. Behind every statistic is a human being. Behind every broken machine is a family praying for a miracle. Behind every campaign promise is a nation struggling to survive. Jamaica's healthcare crisis is not tomorrow's problem. It is today's emergency. And survival should never depend on wealth, luck, or political games. It should be a guarantee. So if you believe Jamaicans deserve better, share this video. Spark the conversation. Hold leaders accountable. And subscribe, because we will continue shining light on the truths that matter. Because the price of survival should never be counted in broken promises. It should be counted in lives saved. And Jamaica deserves nothing less. To understand how Jamaica reached this point, we must step back into history. For decades after independence, Jamaica's healthcare system was modeled on the British public health structure, a universal promise of free care at the point of service. Hospitals were meant to serve every Jamaican equally, whether in Kingston's bustling capital or the hills of St. Elizabeth. But economic shocks, rising debt, and structural adjustment programs in the 1970s and 80s drained that promise. Hospitals became underfunded, nurses underpaid, and investments delayed. International lenders demanded austerity, and healthcare budgets were among the first to be squeezed. The result? A proud system slowly withered. Generations grew up knowing hospitals as places of long waits, broken equipment, and exhausted staff. Parents told their children, "Don't get sick, it's too expensive." And that warning became part of everyday survival. Even today, older Jamaicans recall stories of walking miles to clinics that had no medicine or waiting weeks for an X-ray that never came. The legacy of those years still shapes the crisis we see now. If there is one hospital that symbolizes Jamaica's healthcare struggle, it is Cornwall Regional in Montego Bay. Once a proud institution serving Western Jamaica, it became a cautionary tale of broken promises. Renovations were first announced in 2017 after patients and staff complained of toxic mold, broken air conditioning, and unsafe conditions. At first, the government promised swift repairs. The budget was set at around 2 billion Jamaican dollars. But years later, the hospital remains unfinished. Costs have exploded past $14 billion. Deadlines have been extended repeatedly. Patients are still diverted to temporary facilities that barely meet basic needs. Doctors work in makeshift spaces, and families travel hours to Kingston for specialized care. The scandal isn't just about money wasted, it's about lives disrupted. Cornwall was supposed to serve hundreds of thousands of people. Instead, it became a grave reminder of how mismanagement and corruption can turn a public institution into a public betrayal. And Cornwall Regional is not an isolated case. Across the island, unfinished renovations, missing equipment, and delayed projects tell the same story. One of the most overlooked parts of Jamaica's healthcare crisis is mental health. Depression, anxiety, and trauma silently affect thousands, yet the system barely acknowledges them. Jamaica has only a handful of psychiatrists for a population of nearly 3 million. The majority are based in Kingston, leaving rural communities with almost no access. Stigma keeps many from seeking help, and when they do, the wait is unbearable. Bellevue Hospital in Kingston, once one of the largest psychiatric hospitals in the Caribbean, struggles with overcrowding and outdated facilities. Instead of rehabilitation, many patients feel abandoned. Families often hide mental illness out of shame, making the crisis invisible. The human cost is devastating. Untreated trauma contributes to violence, substance abuse, and cycles of poverty. A nation already carrying economic and social burdens is weighed down by invisible wounds. When we talk about healthcare in Jamaica, it is not just about broken machines and unfinished hospitals. It's about broken spirits, too. Perhaps the most painful aspect of this crisis is the exodus of Jamaica's healthcare workers. Jamaica is famous globally for its nurses. Trained in tough conditions, they are resilient, compassionate, and skilled. Countries like the UK, Canada, and the United States actively recruit them. The irony is brutal. Jamaica trains nurses with public funds, only to lose them to foreign hospitals. Within 3 years of graduation, more than 70% migrate. In some cases, entire graduating classes are recruited overseas before they even complete internships. Doctors, too, are leaving. Specialists in cardiology, oncology, and anesthesiology are in short supply because many head abroad where salaries are 5 times higher and working conditions safer. This creates a vicious cycle. Jamaica invests millions to train its workforce, then loses them. Patients at home wait longer for care. The few who remain are stretched thin, and the migration continues. It's not just economics, it's a question of dignity. Nurses describe working 16-hour shifts without proper equipment. Doctors recount begging for basic surgical tools. Why stay when other countries offer not just money, but respect? For Jamaicans who can afford it, the escape is private care. Private hospitals in Kingston, Montego Bay, and Ocho Rios provide modern facilities, shorter waiting times, and better equipment. But the price tag is devastating. An MRI scan can cost $60,000 JMD, more than the monthly salary of many Jamaicans. Chemotherapy sessions run into hundreds of thousands. Surgeries can wipe out life savings. Families are forced into impossible choices: sell land, borrow money, or go without treatment. Many depend on relatives in the diaspora to send remittances just to cover medical bills. And even private care has limits. Many wealthy Jamaicans travel abroad to Miami, New York, or Toronto for advanced treatment. This widens inequality. Those with passports and money escape, while the majority are trapped in the crumbling public system. Behind the numbers are human lives. There's the mother in Clarendon who lost her newborn because the incubator at her local hospital wasn't working. The family had to rush to Kingston, but the baby didn't survive the journey. There's the elderly man in St. Mary who needed dialysis 3 times a week. With only a few machines serving the entire parish, he missed sessions and his health collapsed. His children, living abroad, begged him to fly overseas. He refused, saying, "This is my home. I should be able to live and die here." There's the young nurse who migrated to Canada after years of working with broken equipment. She wrote on social media, "I didn't leave because I wanted luxury. I left because I wanted to save lives without feeling helpless." These are not isolated tragedies. They are part of a system where survival depends on wealth, connections, and luck. Jamaica spends about 4.5% of its GDP on healthcare. Compare that to countries like Cuba, which spends over 11%, or even Trinidad and Tobago at nearly 6%. The gap is clear. Jamaica has fewer hospital beds per 1,000 people than the global average. Fewer doctors, fewer nurses, and far fewer specialists. Meanwhile, the burden of disease is rising. Non-communicable diseases like diabetes, hypertension, and cancer are skyrocketing. Trauma cases from road accidents and violence overwhelm emergency wards. And infectious diseases like dengue fever continue to reemerge. In global terms, Jamaica's healthcare system is underfunded, overstretched, and unprepared for the future. Healthcare has long been a political football in Jamaica. Every election season, promises pour in. New hospitals, free healthcare, modern machines. The speeches are endless. But once the votes are counted, many promises evaporate. Cornwall Regional remains unfinished. Rural clinics stay under-equipped. Nurses still leave, and families still suffer. The tragedy is not just broken promises, it's the normalization of failure. Jamaicans have grown used to long waits, missing medicines, and dilapidated wards. Survival has become a gamble, not a right. The answer is yes, but it will take courage. First, accountability. Every dollar spent on healthcare must be publicly tracked. Contracts must be transparent. No more ribbons on half-finished projects. Second, investment in people. Nurses and doctors must be paid fairly, supported with safe conditions, and given opportunities for growth. Jamaica cannot continue to train for export while its own citizens suffer. Third, modernization. Every equipment purchase must include training and maintenance. Technology like telemedicine should link rural patients to specialists in Kingston and even overseas. Fourth, community involvement. Local clinics run by churches, NGOs, and citizen groups can fill gaps. Partnerships with the diaspora can bring not just money, but expertise. Finally, political will. Healthcare must stop being a slogan and start being a national priority. Leaders must treat it not as a campaign issue, but as a sacred responsibility. Change is possible. In some rural communities, mobile clinics supported by NGOs have already begun bringing care to people who would otherwise travel miles. Telemedicine pilots have connected rural mothers with specialists in Kingston. Diaspora groups have donated machines and funded training. These are small victories, but they matter. They show that Jamaicans at home and abroad care deeply about fixing the system. They show that survival doesn't have to depend on luck. But hope alone won't heal a nation. It must be matched with accountability, reform, and relentless pressure on leaders. Behind every headline about billions allocated is a patient waiting in pain. Behind every broken machine is a mother watching her child struggle. Behind every scandal is a family forced to choose between survival and death. Jamaica's healthcare crisis is not just about numbers. It's about life and death, about dignity, about justice. The price of survival should not be measured in money, privilege, or political promises. It should be measured in lives saved. And right now, that price is too high. So if you believe no Jamaican should suffer because a machine is broken or a hospital unfinished, share this video. Start the conversation. Hold leaders accountable. And subscribe, because we will continue shining a light on the stories that matter most. Because survival should not be a privilege. It should be a guarantee. And Jamaica deserves nothing less.